Hello and welcome. Today, we're going to delve into a condition that can significantly impact vision, branch retinal artery occlusion, or BRAO. Understanding BRAO, its causes, symptoms, and management is crucial for preserving sight. Let's embark on this journey to learn more. So, what exactly causes a BRAO? The primary culprit is a blockage in one of the small arteries that supply blood to the retina, the light-sensitive tissue at the back of the eye. This blockage is most often caused by an embolus, a small clot or piece of plaque, that travels from elsewhere in the body, usually the heart or carotid arteries, and lodges in a retinal artery. Less commonly, BRAO can result from inflammation of the blood vessels, known as vasculitis, or from rare blood disorders that increase the risk of clotting. Conditions like high blood pressure, high cholesterol, and diabetes can contribute to the formation of these emboli and increase the risk of BRAO. Rarely, certain genetic conditions or drug use can also play a role. Now, let's understand the pathophysiology, the underlying mechanisms of BRAO. When a branch retinal artery becomes blocked, the area of the retina that it supplies is deprived of oxygen and nutrients. This sudden lack of blood flow, known as ischemia, leads to cellular damage and dysfunction. The affected retinal cells, specifically the photoreceptors and inner retinal neurons, begin to suffer and can eventually die. This damage translates to a loss of function in that specific region of the retina, resulting in a visual field defect. The severity of the damage depends on the size of the artery occluded and the duration of the blockage. If the blockage is relieved quickly, the damage may be reversible, but prolonged ischemia can lead to permanent vision loss. BRAO is not a common condition, but it's also not exceedingly rare. It's estimated to occur in around 1 to 2 people per 100,000 each year. While it can affect individuals of any age, it is most frequently seen in older adults, typically those over the age of 60. Men and women are affected equally. As the population ages and rates of cardiovascular disease, high blood pressure, and diabetes increase, we may see a corresponding increase in the incidence of BRAO. The most common symptom of BRAO is a sudden, painless loss of vision in a specific part of the visual field. Because it only affects a branch of the retinal artery, the vision loss is often localized. Patients may describe it as a blind spot or a curtain-like defect in their vision. The location of the visual field defect depends on which branch artery is blocked. In some cases, the vision loss may be subtle and go unnoticed initially, especially if it affects the peripheral vision. Some people might experience fleeting episodes of vision loss, known as amaurosis fugax, before experiencing a more permanent blockage. It is important to seek immediate medical attention if you experience any sudden changes in your vision, no matter how minor they may seem. Diagnosing BRAO typically involves a comprehensive eye examination by an ophthalmologist. This includes checking visual acuity, examining the pupils, and assessing the visual fields. The key diagnostic tool is ophthalmoscopy, which allows the doctor to directly visualize the retina and identify signs of BRAO, such as retinal whitening or edema in the area supplied by the blocked artery. Fluorescein angiography is another important diagnostic test. In this procedure, a dye is injected into the bloodstream, and pictures are taken of the retinal blood vessels. This can reveal the site of the blockage and the extent of retinal ischemia. Optical coherence tomography, or OCT, is also useful for assessing the thickness and structure of the retina and can identify signs of retinal damage. Because BRAO is often linked to underlying cardiovascular conditions, further investigations, such as blood pressure monitoring, cholesterol testing, and cardiac evaluation, may be recommended to identify the source of the embolus. While there aren't strict classifications for BRAO, it's helpful to categorize them based on the location of the occlusion. BRAO can be classified based on which branch artery is affected, e.g., superior temporal, superior nasal, or inferior nasal. The location of the occlusion helps the doctor determine the area of the retina at risk and predict the pattern of visual field loss. Unfortunately, there is no universally effective treatment for BRAO, especially if significant time has passed since the blockage occurred. The primary goal of management is to identify and address the underlying cause, such as high blood pressure or carotid artery disease, to prevent future events. In some cases, if the blockage is identified very early, within a few hours, treatments aimed at dislodging the embolus, such as ocular massage or thrombolytic agents, may be considered, but their effectiveness is not well established. Intravitreal injections of anti-VEGF medications are sometimes used to treat macular edema or swelling of the macula, which can occur as a complication of BRAO. The focus is on optimizing overall health and managing risk factors to prevent further vascular events, both in the eye and elsewhere in the body. While not always preventable, there are steps you can take to reduce your risk of developing BRAO. The most important is managing underlying medical conditions like high blood pressure, high cholesterol, and diabetes. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking is also crucial. If you have a history of cardiovascular disease or stroke, it's essential to work closely with your doctor to manage your risk factors and take any prescribed medications. Regular eye exams, especially if you have risk factors for BRO, can help detect early signs of vascular problems and allow for prompt intervention. The prognosis for BRO varies depending on the severity and location of the blockage, as well as the time elapsed before treatment. Some individuals may experience only mild visual field defects, while others may have more significant and permanent vision loss. If the blockage is small and located in the periphery of the retina, the impact on central vision may be minimal. However, if the blockage affects a larger artery or involves the macula, the central vision can be significantly affected. Recent research is focused on developing more effective strategies for preventing and treating BRO. Studies are investigating the use of neuroprotective agents to protect retinal cells from ischemic damage, as well as novel imaging techniques to improve the early detection and diagnosis of BRO. Research into methods for dissolving or dislodging clots within the retinal arteries is also ongoing, offering hope for improved outcomes in the future. Thank you for joining us today as we explored the complexities of branch retinal artery occlusion. It is vital to always consult with qualified healthcare professional to get assistance and guidance.